So in the previous video, actually we watched the basic anatomy of the heart with the help of a plastic model. I will be looking the live model here. I will do the live demonstration. This is the heart basically, and this is the heart of a goat, and here you can see that on the outer side actually it's actually having a covering, and this covering, this is called the pericardium. This pericardium, this layer, this covering, this is called the pericardium. Now as I mentioned, the pericardium actually having two layers. One is the most outer layer, that is called the fibrous pericardium, which is here actually the toughest one, is the fibrous pericardium, and they are containing the serous pericardium, which is just inside of the, just closely related to the heart, just close in contact with the heart, that is the serous pericardium. And serous pericardium actually containing two layers. One is this is called the parietal layer, and here actually containing a layer, but it's not visible here. This is called the visceral layer. Now between the parietal and visceral layer, they are containing the serous fluid to actually give the protection from the friction. Now as I mentioned that the heart, actually this is the apex of the heart, and this part, this is actually the base of the heart. This is the apex, and just underneath that, that is the base. Now the heart actually, this is the tip of the heart, and this is it actually having total three surfaces. Is the sternocostal surface or sternocostal surface, which is just close in contact with the sternum, and this is the opposite part of the heart. This is the diaphragmatic surface, which is just over the diaphragm, and this is basically the left surface. So these are the three surfaces of the heart. Now this is the right side of the heart, and this is the left side of the heart. So in the right side, here present is the atrium. This part is called the atrium, and this is called the right atrium, as is present on the right side. That's why it is called the right atrium. Similarly, just on this part, this is actually called the left atrium, as it's just present on the left side. So this will be called the left atrium, and this part is called the left auricle. This is the right ventricle, which is here located, and this is basically the left ventricle. Now I mentioned that right ventricle is little bit smaller than the left ventricle, because the left ventricle having a bigger space for pumping forcefully the blood to different parts of the body, to different tissues. That's why it's actually containing more muscles than here, and its space is also big rather than here for pumping the blood forcefully to all of the parts of the body. This group, this is called the anterior interventricular group. This group is running. This is called the anterior interventricular group, and it is just before the apex of the heart. This group is running just before the apex of the heart. Now if we go to the posterior side, now this group actually coming like here, from here actually it's coming where actually I did the incision here. This is called the actually posterior group. I mean posterior interventricular group, this group. Now here containing the coronary artery, the branches of the coronary artery, and from this auricle actually this is called the transverse group, which is just moving from here, and ultimately it's going to backside. This is called the transverse group. This is called the transverse group. This is also called the transverse group, which are just running transversely, and this is, as it's running longitudinally, so this is also called the longitudinal groups. So this is the transverse group, which is running here. This actually, or this is called the atrioventricular junction, this group, and this group, and this is basically the interventricular group. Okay, so let's see about the atrium and the ventricle. We already understood from the anatomical model. Actually this heart is not actually in good feature, so that I can demonstrate but I actually tried to demonstrate on the model. Now we'll see that inside of the ventricle what their contents. So if we open the ventricle, we'll see like this structure. Here you can see that this structure. Now after opening of the ventricle, here we can see that this structure, these are the valves exactly. Here we can see some chordae tendineae. These are the basically the connective tissue, elastic connective tissue, and this connective tissue, this is called the chordae tendineae. This is called the chordae tendineae, and these are the actually valves. These are the valve. This is the right cuspid valve. As I actually open the right atrioventricular junction, so on this junction actually there contains a tricuspid valve. Now these valves actually containing total 3 cusps is not possible to show here, and just here actually this is the right atrium. So this valve actually connected by chordae tendineae with these papillary muscles. These are called what? These are called papillary muscles. Now these papillary muscles, whenever they actually contracts, the valves become closed due to this connective tissue. Whenever this actually contracts, this will be also contracted due to this papillary muscle, and the valve will remain closed. So the blood which actually came to the right ventricle, so it will be not backflowed. And here actually these are the moderator bands. Here you can see these bands, these are called the moderator bands. These moderator bands are very much helpful actually for the extensive expansion of the heart. It actually protects from the extensive expansion of the heart or over expansion of the heart. So this is actually the ventricular contents, and these muscles actually, this is called the trabeculae carni. The trabeculae carni, this muscle actually present in the ventricle. Now it is more clear that this actually I said that these are the chordae tendineae, these are the papillary muscles, and this is actually the valve. Now this is actually this is the right ventricle. From this right ventricle, blood will just go by the pulmonary artery. It will just, the deoxygenated blood will go from the right ventricle directly to the lung. There will be the gaseous exchange, and after the gaseous exchange by the pulmonary veins, the blood will come to the left atrium. Now this is actually left ventricle. On this junction actually they are containing the bicuspid valve, though actually it's not visible here. This is actually here containing the bicuspid valve, which are also attached with the chordae tendineae directly with the papillary muscles. Then from here there will be the origination of the aorta, the great aorta. So whenever the blood actually will be pumped by the left ventricle, the blood will be just going to all parts of the body. Now here you can see that these are the pulmonary veins. Here this is the pulmonary veins. Now how we can identify that what are the veins and what are the arteries actually going and coming here? This can be done by inserting a thin object inside of the artery or vein to identify the where actually it's opening. So if you find that this is actually opening in the left auricle, then this will be obviously the pulmonary veins. Then if it's just opening on the left ventricle, then this will be called the aorta. Then if it's just opening here, if the duct actually are opening here, so you need to understand that there will be the pulmonary artery. So if you insert it, there will be some valves obviously. So if you insert it, then you will understand that where actually what content and from where actually it is originating. Now here you can see another structure, this structure. this structure, basically this structure is called the aorta. This is called the aorta, the great artery. This is called the aorta. This aorta actually containing total three parts. This is the ascending aorta, and there will be the arc, and there will be the arc. So this will be called the arc of aorta. Then this aorta will be just moving posteriorly. Then this aorta will be moving just posteriorly, and this will be called the descending aorta. Now from this descending aorta, the blood vessels, this will be just supplied, the blood vessels will be originated from the descending aorta, will be supplied to different parts of the body, to different tissues. So this was basically the short description of the heart with the live demonstration, as here is the scarcity of the model, so I couldn't show you in details. So if I get the models in future, then obviously I'll make another video on that, on descriptive demonstration. Now here we actually observe the heart. We'll observe the heart with some graphical softwares that we'll just see the exact position of the heart and location and associated structure. Here you can see the heart. I already described it, that this is the heart. Actually this heart containing total three surfaces. One is the sternocostal surface, or this is called the anterior surface, which actually it is marked here. On the left side, this is called the left surface, and just on posterior side, this is called the diaphragmatic surface, or this is called the posterior surface. And here you can see that this is the apex of the heart, which is pointed here, and on the posterior side, this is totally called the base of the heart. Then here on the left side, actually here you can see that atria and ventricle, there is a group between them. This is called the atrioventricular group, or this is called the transverse group. Similarly, here you can see that this is on the left side, there is also the left atrioventricular group, or this is called the left transverse group. So this is called the right transverse group, which is just between this, and this is called the left transverse group. Now here you can see that this is the anterior group. Actually it's not shown here, but where the actually coronary arteries, the anterior interventricular branch of the left coronary artery, that is actually moving from here. So this group actually over which it's actually moving, this is called the anterior interventricular groove. And here also you'll get the great cardiac veins, and great cardiac veins are divided into some minor vessels, and these vessels actually are supplying all of the heart. Then here you can see that this right coronary artery, which is originating from here, from the coronary sinus, and ultimately it's just moving along, just making a circle. This is called the circumflex branch of the right coronary artery. Similarly on this side, there will be the circumflex branch of the left coronary artery. Then this is called the right atrium or auricle, and here is the two ventricles, one is the right ventricle and one is the left ventricle, and this is the left atrium. Here you can see that this bluish color, this is called the pulmonary artery. We know that what actually pulmonary artery is doing. The pulmonary artery actually taking all of the bloods from the right ventricle, and it's just taking the blood to the lung. Similarly, just after the purification from the lung, through the pulmonary vein, all the blood actually come to the left atrium. You can see that this is the left atrium and this is the pulmonary vein. Also I mentioned that from the left ventricle there will be the origination of the aorta, the great artery, which you can see here. This is the great artery aorta, and this actually having three parts. One is actually here originating from the left ventricle, and it's ascending. That's why actually it is called the ascending aorta. It actually going upwards. That's why it's called the ascending aorta. And this part is called the aortic arc, or this is called the arc of aorta. That means it's actually taking the arc and going to the posteriorly actually it's moving posteriorly and then it actually descends. That's why that part is called the descended aorta. So there are total 3 parts of aorta, 3 segments. One is the ascending aorta, then arc of aorta, and the descending aorta, which is not shown here. And here you can see that the arc of aorta actually giving 3 origination of the arteries. 3 arteries is actually giving the origination of 3 arteries. We'll be talking about those in different videos. Here also you can see that these are the veins, actually pulmonary veins. These are the pulmonary veins. So this is actually the heart. And here, just in this part, these are the great cardiac veins which are moving from here, and on this junction there will be the origination of the coronary sinus. Also here you can see that this is the superior vena cava. This is the superior vena cava, which is actually, or this is called the cranial vena cava, which taking the blood from the head region as well as from the forelimbs. And then this is called the inferior vena cava, or this is called the caudal vena cava in animals. It actually taking all the blood to the atrium from the lower part of the body as well as from the limbs, the hind limbs. I described in the atrium there will be there will be 3 openings. Now one opening is for the superior vena cava, one is for the inferior vena cava, and one is for coronary sinus. We actually described about this. The coronary sinus actually this is responsible for giving the blood supply to the own of the heart. So this is basically a short review of the heart. Now let's see actually how heart actually doing the pump. Here you can see the pumping of the heart. The heart is pumping like this all the time in our body. So this is the auricle or atria. This actually, whenever these atria are actually contracting, the blood are getting the blood actually going to the ventricles. And this actually, the atrium, when this atria actually contract, this is called the atrial systole. And when the ventricles actually getting dilated, this is called the ventricular diastole. And whenever the ventricles actually doing the contraction, these are called the ventricular systole. And when the atria actually getting dilated, these are called the atrial diastole. Here you can see a clear video. Here you can see that where the heart is situated. The heart, I described that this is situated in the thorax, specifically in the middle mediastinum. And this is same in the humans and animals. And I described that in case of the animals, in cattle actually, this actually located at the level of 2nd to around 4th ribs, thoracic ribs. So this is basically all about it. Now here I'll show you some photos. Here you can see that this heart is located like this, and I described the heart is located in the cattle just between the 2nd ribs, and it's elongated just between the 2nd ribs to around 4th ribs, and it is actually elongated between them. And here you can see the exact anatomical position of the heart. So if you just want to hold the stethoscope on this region, actually on the point of elbow, so you will get the heartbeat here. From here, actually this reddish mark, this, if I just give another color, like this part, and these are the pulmonary artery and pulmonary veins. And here you can see that this is the brachiocephalic artery. This is the brachiocephalic artery. If I just make it another color, so here you can see this which is going like this. So this is actually the brachiocephalic trunk, which is actually giving the blood supply to head region as well as in the brachium, I mean in the limbs, in the forelimbs. And this is what you can see, that this is the aorta, which is originating from the left ventricle, and it's actually giving the supply to lower part of the body or caudal part of the body. And the hind limbs. Now let's see some more photos. So this is the pulmonary artery, what I shown you already, and this is that anterior interventricular groove, and these are the transverse groove, and this is the brachiocephalic trunk. This is the brachiocephalic trunk. We'll be talking about all of those blood vessels in another video. Here actually this is, you can see, these are basically the brachiocephalic trunk. Now, by this photo, in this region, what you can see here, this is another demonstration of the heart, how it's located. And this is the what? This is that aorta, and this is the brachiocephalic trunk. This is another photo. So this is that photo. This is another photo. This photo actually showing the structure of the heart, the shape of the heart. And this is the trachea. Actually what you can see here, this actually moving just behind that. And this is what? This is the aorta. As the aorta is actually going here actually, and it, as I mentioned, that this will just go to the caudal part, or this will just go to the lower part of the body, and ultimately will give supply there. And from here actually there will be the what? There will be the, here you can see, these actually are the brachiocephalic trunks. These are the branches of the brachiocephalic trunk, which actually giving the supply to head region as well as the full length. This is another photo where you can see that this is the ribs, these are the ribs, these ribs, and this is just located here, this heart. So this was actually all about the heart demonstration with live demo, as well as from the graphical software, as well as from an atlas book. Thank you so much.